Okay, we're going to look at the cleave enzyme. Okay, using the enzyme methods of degradations. So we take, for examples, like our example. The good example over here is acetylcholine. So acetylcholines basically at the cholinergic synapses. Okay, when we use the cholinergic synapses, our acetylcholine terase. Okay, when anything enzyme, basically they will end up with the RAS, okay, race. So this acetylcholine ternase, basically they rapidly will break down the acetylcholines into acetates and the choline as well. Okay, right at this particular cleave. So whereby they want to make sure that the signal will turn off as fast as have been turned on as well. Okay, almost like hitting the mute right after the sound play. So these breakdowns products can be often recycled as well, whereby these cholines, for instance, can be taken up back into the presynaptic terminal to make more acetylcholine. Okay. Well, on the other major mechanism is the reuptake. So this is especially very important for the neurotransmitter like serotonins, dopamines, and even norepinephrine as well. Okay, so just recall, if let's say we are talking about the serotonin, dopamine, and norepinephrine, we are using the reuptake mechanism. So this transmitter is actively transported back into the presynaptic neurons for occasionally like the glial cell. Okay, by using a very highly specific transporter proteins, it's kind of like a vacuum system whereby they suck up the signal back in and reuse the particular dopamines or serotonins, or they're able to do a degradation as well. So for example, like serotonin, we do have a serotonin transporter as well. We call it as a SERT. Okay, so whereby they will reabsorb into the nerve terminal, and then this can be repacked or broken down by the enzyme. For example, like over here they give you the MAO. Okay, so the MAO basically is the monoamine oxidase. So this process can ensure there's a tight regulations of the neurotransmissions, whereby it's also a key target in the pharmacology. Okay, for example, like the fluoxetines, whereby they block the serotonin reuptake as well, allowing the neuron transmitter to linger more longer on the cleave or to boost it up. Okay, the effects like people having depression. So people having depressions, because we know they're having lower in the serotonin. So what we do is that we block the serotonin reuptake. So your serotonin can remains in this neurotransmitter, so they can release more serotonin for people having depressions. Okay, so whether this cleaving method messenger is chemically or pulling it back, the terminations of the transmission action is just as important as the messenger itself as well. Okay. Okay, I think previously I always mentioned about acetylcholine. So now let us go through the acetylcholine. So let's zoom in into one of the most fundamental neurotransmitter in the nervous system. Short form, we call it as a ACH. So when we look at how it's not only synthesized, but it's also continuously recycled to keep signaling the efficiency and the control. So the process begins when the cholines, the key processor, is transported into the nerve terminal by choline carrier proteins. Okay, so these choline carrier proteins will basically bring up the cholines and to start or initiate it as well. So once inside, they have one enzyme we call as a choline acyl transferase. Okay, they will catalyze, so they will catalyze and combines these cholines and acetyl-CoA to form the acetylcholines. Okay, so in other words, we have both cholines and acetyl-CoA. They will start to form acetylcholine. So this newly synthesized acetylcholines will be stored in the vesicle. If let's say you still remember, okay, they will be stored in the vesicle for the storage. So it can be ready to release as well. So after the actions of the synapses happens, the acetylcholine will be rapidly breakdown. They will broken down into the synaptic cleft, if let's say you still remember, by the enzyme we call it as a acetylcholinesterase, okay, ACHE, into the acetate and choline as well. So if let's say you still remember in the previous slide, we mentioned that the cholines can be recycled back, isn't it? So this breakdown is very important because it can ensure the signal ends swiftly, so allowing the system to reset for the next signal. The choline is also can be reabsorbed via the same choline carrier as well, so then it can be reused to produce a new acetylcholine synthesis. So basically they are creating a closed loops recycling system that can have a balanced neuron transmitter ability with the degradations. So whenever they have a degradations, actually we are taking back the cholines and then we are producing a new acetylcholine. So this kind of like fine-tune process, we call it as a cholinesterase, whereby they helps to regulate the balance between synthesis and the breakdowns. Okay, now here's where the pharmacology come into the play, whereby we already know there is a cholinergic system is a major target for the drugs. So this drug basically they're able to act in a various level of the pathway as well. So they may mimic the acetylcholines by acting directly into the muscarinic receptor. Okay, so we have a muscarinic agonist, or we can even block them to inhibit the particular functions. We call it as a muscarinic antagonist. Okay, so to enhance, we call it as an agonist. To inhibit or to block it, we call it as an antagonist. So some of these drugs, they act in the nicotinic receptor, okay, in the glial cell. So either it can stimulate them by using the ganglion stimulating drugs, or they can inhibit them by using the ganglion blocking drugs. Okay, so other targets for the neuromuscular junction, for example, like neuromuscular blocking agents, they can use in the anesthetics. Okay, so perhaps most of the importance, mostly some of the drugs they can interface with the acetylcholines. So whereby we call it as an anti-cholinesterase. So whereby they inhibit the acetylcholines, and also they inhibit the particular of acetylcholine breakdowns, and it can prolong the actions. Okay, this is a part of a strategy for treating some of the disease, for example like Alzheimer's disease. Okay, together we're trying to understand on how this acetylcholine is being made, breakdowns and recycle, whereby they can give us a deep insights on how we can tweak this kind of a system to treat various neurological and muscular disorder as well. Now we can explore on the powerful class of drugs, whereby we know as a muscarinic agonist. Okay, I think previously we already talked about the muscarinic, so try to refer back to the tables. Other than muscarinic agonist, we can call it as a parasympathomimetics. Okay, so they mimic. Okay, so they're able to mimic these particular actions of the parasympathetic nervous system, because we have parasympathetic nervous system to cool down our body systems, right? So this compound basically they're able to produce an effect having a more similar. It happens when the parasympathetic is naturally activated. So, for example, parasympathetic stimulations, slowing the heart, stimulating the digestions, or increasing the glandular secretion as well. So, basically, if let's say you still remember, parasympathetic is meant for rest and digest function. Okay, so structurally, they are resemble towards the acetylcholines, and some they know, for example, include like butanol. Okay, we have these butanols, and we have these pilocrines. So pilocrine and butanol basically they can act, or they can mimic towards the acetylcholine as well. So these both drugs they can bind directly towards the muscarinic receptor, and then can activate them and produce a range of these physiological effects, well, depending on those receptors that have been located as well. If let's say you still remember, each of the cellular, they have their own receptor. Okay, basically when we talk about the systematic effects of the muscarinic agonists, they can span across the multiple organ system. Okay, so over here we have three different organ. We have the cardiovascular, the smooth muscle, and the exocrine gland. Okay, so if let's say we look at the cardiovascular effect, they're able to slow down the heart rate and reduce the cardiac outputs. Okay, by causing vasodilation. So vasodilation, that means your blood vessel be enlarged. So this allows your vascular in certain type of vascular bed as well. And on the other hand, if let's say we're looking at the smooth muscle, okay, excluding those in the blood vessel, they can promote constrictions. Okay, for instance, they're able to increase the motility in the gastrointestinal tract, and then they're able to stimulate the bladder emptyings and enhance the bronchial constriction as well. So then when it comes to the exocrine glands, okay, the muscarinic agonists basically they're able to stimulate the secretion. So this include sweating, salivations, and the lacrimentations and bronchial mucus production as well. So in some of cases, it can lead towards breathing difficulty in certain patients as well.